A new study has revealed a stark warning about the long-term health risks associated with butter consumption, suggesting that replacing it with certain plant-based oils could significantly lower the risk of mortality. Despite a growing trend on social media promoting butter and animal fats as healthier alternatives to seed oils, the findings indicate that higher butter intake is linked to increased mortality, particularly from cancer and cardiovascular disease. In contrast, individuals who consumed more plant-based oils, such as olive, soybean, and canola oil, experienced a notable reduction in overall mortality, reinforcing decades of research warning against excessive saturated fat intake. The study, which analyzed dietary data from over 221,000 participants across three major long-term health studies, tracked dietary habits for more than 30 years. Researchers found that participants who consumed the most butter had a 15% higher risk of death compared to those with lower intake, while those who replaced butter with plant oils saw a 16% reduction in mortality. The most alarming finding was that substituting just 10 grams of butter per day, less than a tablespoon, with plant-based oils was associated with a 17% reduction in both total mortality and cancer-related deaths. This suggests that even a small, consistent change in dietary habits could have profound effects on longevity and disease prevention. The widespread belief that butter is a health food has gained traction in recent years, fueled by influencers and alternative health advocates who claim that seed oils are toxic and that animal fats are superior. However, leading nutrition experts, including the study's co-author Dr. Walter Willett of Harvard-T.H. Chan School of Public Health, strongly refute these claims, warning that they are not supported by credible scientific evidence. The misconception that butter is beneficial, Willett argues, is one of many diet myths circulating online without real medical backing. The new research provides a strong counterpoint to these unverified claims, reinforcing previous studies that have linked high saturated fat intake to increased risks of heart disease and premature death. The fundamental issue with butter, according to the study, is its high saturated fat content, which makes up nearly 2/3 of its total fat. Saturated fats have long been associated with higher levels of LDL cholesterol, the so-called bad cholesterol, which increases the risk of arterial plaque buildup, leading to heart disease, stroke, and other cardiovascular complications. While some argue that butter contains beneficial nutrients, including fat-soluble vitamins, these potential benefits are vastly outweighed by its negative impact on overall health. Unlike butter, plant-based oils contain unsaturated fats, which are known to reduce inflammation, improve heart health, and provide essential fatty acids that the body cannot produce on its own. The study also highlights a troubling trend in dietary misinformation, where influencers with little to no scientific background promote high-fat, animal-based diets as superior to plant-based alternatives. Some social media personalities have actively encouraged the replacement of vegetable oils with tallow or ghee, despite mounting evidence that excessive saturated fat consumption is harmful. The rise of movements, such as making frying oil tallow again, reflects a broader shift toward prioritizing anecdotal claims over scientific research, which can have serious public health consequences if people make uninformed dietary changes based on misinformation. While the study does not suggest that butter must be completely eliminated from the diet, it strongly cautions against using it as a primary fat source. The occasional use of butter for flavoring or in traditional dishes is not inherently harmful, but making it a staple in daily meals could lead to significant health risks over time. For those looking to transition away from butter, the study recommends olive, soybean, and canola oil as the best alternatives due to their high content of anti-inflammatory omega-3 fatty acids. Omega-3s are essential for brain function, heart health, and immune system regulation, providing benefits that butter simply cannot match. However, not all plant-based oils offer the same level of health protection. Some oils, such as corn, safflower, and sunflower oil, are high in omega-6 fatty acids, which, while necessary in small amounts, can contribute to inflammation when consumed in excess. The American diet is already disproportionately high in omega-6 fats due to the prevalence of processed foods and fast food consumption, further increasing the risk of chronic disease. Nutrition experts suggest a balanced approach, incorporating a variety of healthy oils while minimizing reliance on processed foods that are rich in unhealthy fats. Despite the strength of the study's findings, there are limitations to consider. The research is observational, meaning it establishes a correlation between butter consumption and mortality, but does not prove direct causation. However, the consistency of these results with previous research, combined with decades of evidence linking saturated fat to poor health outcomes, makes a compelling case for reducing butter intake. The findings align with dietary recommendations from major health organizations, including the American Heart Association, which advises limiting saturated fat intake in favor of healthier, unsaturated fats. The public health implications of this study are significant, as small dietary changes could lead to major reductions in disease burden across populations. If more individuals replaced butter with plant-based oils, the number of preventable deaths from heart disease, stroke, and cancer could decline substantially. Public health initiatives should focus on educating consumers about the risks associated with high saturated fat intake and promoting healthier alternatives backed by scientific research. The results of this study serve as a critical reminder that nutrition science evolves based on rigorous, long-term research, not viral diet trends or influencer endorsements. While dietary choices are personal, they should be guided by reliable evidence rather than social media fads that lack scientific credibility. The message is clear: butter, while not inherently dangerous in small amounts, is not the health food that some claim it to be. Replacing it with plant-based oils, even in small increments, can significantly improve long-term health outcomes and reduce the risk of premature death. In a world where misinformation spreads rapidly, it is more important than ever to rely on trusted medical and scientific sources when making dietary decisions.